Well, hey everybody, just want to welcome you to my little quick video here that's going to cover the benefits at a glance and the summary of benefits. So you can see all the details about the new plan, the Honor Plan it's called, that we talked about on the other video. I introduced it. This is a plan that does not have drug coverage. So if you need Part D drug coverage, this is not for you. But if you're a state retiree, you've got drug coverage. If you're Champion Paper Mill retiree, you've got drug coverage. If you're a veteran, you've got drug coverage from the VA. Or, like I said in the other video, like if you're my dad and you just don't take drugs and he's never had Part D, this is the plan for him. This could be the plan for you. So I'm going to cover the basics, go over the documents. These are all we can email to you. There's links to them on my website, and we can mail them in the postage to you, which we've probably already done, so you can be looking at this and follow along with me. On this recording, I'm going to do what's called a screen share, and I'm going to show you some pictures on the screen. We'll walk through this together and talk about, start with here, the benefits at a glance. Okie doke, sounds good? So the 2021 R1390-003 Regional PPO Plan. What that means, a PPO means that you can go in or out of network, and it's regional, meaning it's sold in North Carolina and Virginia. You can live in any of those counties and get this plan. Here's the important thing where you see with Medicare only out of network, there is a $1,000 deductible if you go out of the network. But we've had a PPO plan with you guys, some of you 3, 4, 5, 6 years, and we just haven't had complaints of people going out of the network. There's such a strong network. So most things are 35% co-insurance if you go out of network. But for most people that already have this plan with the Humana now, and we're just going to switch to this new plan with the extra benefits, you're really not going to see a difference. I don't think that's going to be a problem. So let's talk about what is important. The premium on the plan is $0, but remember, there's a Part B Medicare premium reduction. In other words, your plan will reduce your monthly Part B premium by up to, it says, $50 in this case. In North Carolina, in Tennessee, and Virginia, it is $50 reduction. So what does that mean? Well, you remember, you pay $144.60 right now for Part B Medicare. They will reduce that next year by $50. Now, of course, if that number goes up a little bit next year, they will reduce the new number by 50. Bottom line is you're going to have $50 more in your Social Security check next year than you would have otherwise if you didn't take this plan. That's a phenomenal benefit. And we're going to go over the copays. You're going to love the copays, but that is $600 a year in your pocket. So that's pretty exciting. So the annual maximum out of pocket, $6,700. What does that mean? The most you have to pay in a year, no matter how sick you get, is $6,700. Now, if you're with the state and with Champion, those numbers are reduced by the state and the Champion benefits, which are lower than $6,700, but that's still the fail-safe protection that you have an annual out-of-pocket maximum. That's not a deductible. That's the most you have to pay. And then the plan pays 100%. Doctors, $20 copay for family doctors, $50 copay for specialists. Preventative screenings, these are things like cancer screenings, mammogram, pap smears, tests, PSA tests, no costs for those screenings at an in-network doctor. Telehealth services, this is in addition to in original Medicare. Medicare itself does not cover these benefits, okay? These are benefits where you look at your telephone and you talk to a doctor, telehealth. It's a new thing these days. No copay for a family doctor, $50 copay to see a specialist with telehealth, urgent care $0, and substance abuse $0 copay. So that's a new thing you can learn about, getting an app on your phone to talk to the doctor. If you go in the hospital, it's $240 a night for the first 6 days. $240 a night for the first 6 days. It doesn't matter if you say 10 days or 30 days, you'll only pay for 6. Now, of course, if you're only in there one night, you'll pay for 1 day, 1 night. That's $240. No copay after that. Lab tests, $0 copay for labs or $50 if it's associated with a hospital. This is why we always recommend LabCorp, or Quest Diagnostics to get your lab work done. You can go to those places, get the lab work done for free, $0 copay. Outpatient care, if you have a surgery, $190. Physical therapy, $10. X-rays, $110. Diagnostic testing, $100. For mental health services, $240 for the first 6 days. For a specialist, for outpatient, for partial hospitalization, this is all mental health services. Emergency services, urgent care is $20. An ambulance is $290. An emergency room benefit is $90. For additional benefits, there's a COVID-19 test and treatment, zero copay for the coronavirus test. Health Essentials Kit, they will mail you once a year a box, and in that box is going to have stuff to help you stay safe and healthy with the virus going around, like a face mask from Humana. It's pretty cool. Mom and Dad got one this past year. They have Humana. The routine dental and vision services, we'll cover that more details in the summary of benefits in a minute. Over the counter, $30 every 3 months. This is a little bit more than the old plan last year. $30 every quarter, every 3 months, over the counter. What is that? Tylenol, Band-Aids, aspirins, cough syrup, over the counter type things. You don't have to go to the convenience store to buy, or the drugstore. Silver Sneakers gym membership program. People that use the gym for silver sneakers for free, they love it. If you're not using the gym, you should. It's a great benefit for your plan. Keep you stronger and healthier. Well Done. That's a program, if you come out of the hospital or a rehab stay, they're going to send you 10 frozen meals delivered to your door so you can recuperate without having to worry about cooking. A routine hearing checkup. That's included. We'll cover more details on hearing aids in a minute. So those are your benefits on the Humana benefits at a glance. Let's look at your summary of benefits for this plan. Okay, scrolling down. We have, let's talk about the Humana Honor Plan. Again, remember, this is a plan that was originally designed for veterans because they get their drugs from the VA. But if you have drugs from a retirement plan like Champion Paper or the state, this will work for you. You do not have to be a veteran. Just like my dad, he's a veteran, but he doesn't get his drugs from the VA because he doesn't take any drugs. So this works for my dad too. So to be eligible for the plan, you have to have Part A Medicare and Part B and live in the service area. So you have to have Medicare. How to reach us, there's phone numbers about how to reach Humana and websites. You got that. No cost for the plan and a $50 reduction of your premium for your Part B Medicare. So they're going to reduce your Medicare premium by $50. That's $600 a year extra in your pocket next year for taking this plan. $1,000 deductible if you go out of network, 35% copay straight down the board for most everything else. But again, we really don't have network problems in our area. We haven't experienced them. We don't anticipate it. A maximum out of pocket, $6,700 we talked about, $10,000 if you go out of the network. But again, not a problem. Let's see, hospital, $240 a day for the first 6 days. So this is the stuff we covered. This just gives you more details. Like for instance, you do not need a referral to see doctors on this plan. You can go straight to a specialist of your choosing. More details are here. Outpatient hospital service, $240. Outpatient surgery at a surgery center, $190. So if you get a surgery at a not hospital, but it's outpatient, it's going to be cheaper than in the hospital. Doctor's office visits, 20, specialist, 50, just like we said before. The preventative care stuff, remember I said things like mammograms and PSA tests, there's a bunch of it. All these different things. Of course, you can read this when you get your book. We've sent you a book already. Emergency room, $90. Urgent care, $20. Diagnostic mammograms, $50 to $75. Radiology, $180 to $275. Lab work, $0 to $50. Again, go to Quest Diagnostics or LabCorp. Get your labs for free. Diagnostic tests, x-rays, radiation therapy. Medicare covered hearing. If you need a Medicare covered hearing exam, it's $50. Then you get routine hearing benefits. $0 copay for the fitting and $6.99 copay for an advanced level hearing aid up to 1 per ear per year, $6.99 copay, or $9.99 copay for a premium level hearing aid. Now, my dad has hearing aids. He wanted to get the best, so he spent a lot more. He didn't use this benefit. You might want to try this benefit. You can call Humana, and they can tell you places you can get these hearing aids. I'm not going to make a big deal about hearing aids because most people want a higher quality hearing aid. So I'm not going to make this to be like the best thing since sliced bread and get you disappointed, but you're certainly welcome to look into it. Medicare covered dental copays, which there are very few Medicare covered dental services, but if there was something, it would be $50 copay. Then you get into the new benefit. You remember me talking about a $2,000 yearly dental benefit. No copay. Look at all this. $0, $0, $0 for all these different things. 000, and then it says $2,000 combined maximum benefit coverage for preventative and comprehensive. What does that mean? Well, preventative is your cleanings and your normal x-rays. Comprehensive would include everything from a root canal to a crown, basically everything but cosmetic. So up to $2,000, no deductible, no copay, 100% coverage, up to $2,000. This is a phenomenal benefit. You can use it at any dentist, okay? If they're out of the network and they'll file it for you, great. You can use the benefit there. It's going to be fantastic. Tell your friends about it to give me a call. Vision services, Medicare covered vision exam, $50. Diabetic exam, 0 copay. Glaucoma screening, 0 copay. Cataract surgery, after that, you might need some glasses or contacts, 0 copay. The Vision Network, 0 copay for refraction up to 1 a year. That's normally about a $45 charge to your doctor. Here it is for 0. This is if you use a Humana Network place, like for instance, the $100 off of glasses or contacts, you would probably need to go to Lens Crafters to get one of the doctors that's in that Vision Network. Okay, so that's where you'd get $100 off if you want to go to Lens Crafters. Mental health services are detailed right here, $240 a day for the first 6 days. Outpatient and group therapies, $40 to $100. Skilled nursing, if you go to rehab, the first 20 days are free, just like Medicare. After that, days 21 through 100, it's $184 per day copay. Now, if you need more skilled care than 20 days, the good thing about this plan is, remember, you have a maximum out of pocket. That's $6,700. If you go days 21 through 100 with just Medicare, you don't have a maximum out of pocket. You'll go way over $6,700 on skilled nursing care if you need more than 20 days. Physical therapy, $10 to $40. Again, Medicare covered medical and hospital benefits continued. Ambulance, $290. Air ambulance, 20%. That's a bargain, 20%. Drugs. Now, this plan does not have Part D, D as in drugs, drug coverage, but it does have Part B, B as in boy. These would be drugs like chemotherapy drugs or drugs that you would take in a doctor's office, like a therapy that's through intravenous therapy drugs. 20% of the cost of that. So that is not a Part D benefit. This will not mess up your retirement insurance whatsoever. Additional benefits, a foot care, $50. Medicare covered chiropractic services, $20. Medical equipment, 15% for durable medical equipment. Things like wheelchairs and oxygen, walkers, those kind of things. Medical supplies, prosthetics, artificial limbs, 15%. Diabetic monitoring supplies are 0 copay through the Humana Pharmacy. Diabetic monitoring test strips, those kind of things. Rehab services and physical, occupational, and speech therapy, $10 to $40. Cardiac rehab, $10. Pulmonary rehab, $10. Telehealth services, again, talking to a doctor on your cell phone, your mobile device, 0 copay for family doctor, $50 for specialist, 0 for urgent care. Substance abuse, 0 also. So that's definitely something to consider right there. And then more benefits with your plan, no costs or copay for COVID-19 tests or treatment. The health kit, they'll mail you once a year a box of stuff like the mask. They'll say Humana, it's green, it looks pretty. I see them in the grocery stores all the time. Over the counter, $30 every 3 months quarterly for over the counter. Your silver sneakers benefit, you can use your gym pretty much anywhere in the country. Go to silversneakers.com. There's over 15,000 gyms, and yes, gyms are opening up again. So, and then travel, you can use your Humana PPO anywhere in the country. Because it's a PPO, you can go to find a network doctor pretty much anywhere. And then Humana Well Done, that's the 10 frozen meals delivered to your door after a hospitalization or a skilled nursing rehab situation. And for more, you can use Humana's search directories online, and then there's the disclaimer pages as well. So with that, let me stop sharing that. Let me just say, we appreciate you. You guys have been in business with us for a long time, some of you. Some of you may be brand new to us. We hope you'll join our Smoky Mountain Group family. We take care of our customers. You should have a magnet on your refrigerator so you can call us anytime. You do not have to call the insurance company and sit on hold. You call us. We then own the problem and we solve it for you. That's what a good agent does. We're a good agency and we take care of our people. So again, thank you for your time. I hope you enjoyed the presentation and we'll look forward to talking to you guys soon. Have a good one.